Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
glad to be here.
But a mission to
Delivery of. Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to this episode of AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Keesa Smith, and she is the Executive Director of the Arkansas Advocates for Children and Families. Keesa, thank you so much for joining us.
No, thank you for inviting me.
So tell us about your work. Tell us what the organization does.
Yeah, so Arkansas Advocates, we've been around for 45 years. So we were started by a small group of individuals that felt like Arkansas could do better for children. And they started a group, and we've been able to continue on for all of these years. And the main premise is nonpartisan policies that are all about advancing children and ultimately their families as well.
And what are the hot button issues right now in Arkansas?
You know, there's so many. Depends on who you're talking to. I think, the biggest issue that is on the forefront of everyone's mind is education. Whether you're a fan of LEARNs, whether you're not a fan of LEARNs, it is a major overhaul of our education system here in Arkansas. And so everyone is looking to see what is going to happen with our children as a result of it. Are children going to be going to get better results? Because the reality is that prior to LEARN's passing, we were doing very, very poorly as it pertains to our reading efficiency and our math efficiency. So I think everyone can agree that there was a need for some level of change. But we want to make sure equally when you're doing something as big as this system change that every child is able to get a quality education that they deserve. The quality education that many of us reflect back on because so many individuals are products of the public school system. So that's the big one. But I think the thing that's on everyone's mind, and we're glad to hear that, is maternal health. Because in Arkansas, we've performed poorly for years. We are absolutely last as it pertains to maternal health. There was one year where we were second to last. And I remember seeing those studies come out and I said, oh, we've done better. Great. So going to see what happened. And it's actually that Mississippi dropped down and tied us for last. And then when they went back up, we were last. And so that's really something that everyone is thinking about, talking about right now.
And Arkansas, as you mentioned, has the highest maternal mortality rate. So what does the Advocates organization do? When you say be advocates for that, what are you seeing down the horizon for change?
So even during the last legislative session, we had two pieces of legislation that we were heavily advocating for. And we also work with other stakeholders that are equally talking about things that can advance what our maternal health landscape looks like. Because the reality is that it's not just going to be one magic pill piece of legislation that's going to make our state better. So when we were looking at things, we were looking at postpartum coverage from as it pertains to Medicaid. And we were also looking at the process in which women get onto the Medicaid rolls. Because unfortunately in our state, many women are learning that they're pregnant later on. These are not, and I said unfortunately, but things happen. So sometimes pregnancies are not planned. And if they're not planned and you don't have Medicaid coverage prior to, and you find out that you're pregnant, if you're 4 or 5 months pregnant and then you have to go through the Medicaid application process, then that makes prenatal care very, very tricky because you may be waiting for some time to become eligible. And so we were equally advocating for pregnant women to be able to get onto the Medicaid rolls faster. So.
And is that affecting rural communities or is it just across the board? Is there a socioeconomic group?
Yeah.
What are you seeing?
Based on the data we're seeing, it's impacting all women. Because there's two things that we're seeing. One is that Arkansas, out of our 75 counties, the last time I checked, 37 were still considered maternal health deserts. And so that's a stat that we're not talking about as much. Sometimes when you hear about deserts, you hear about, food deserts, which is a problem. All of these things are problems. Whenever we're talking about deserts, it means that there's something that individuals can't access. So that's a problem. But maternal health care deserts is not something that we talk about. And what that means is that in several of our counties, women cannot actually get maternal health care. They have to go to a neighboring county. So that impacts you if you're if you're in any of those counties, but also if you're at a certain socioeconomic level, you don't have access to transportation, being able to get there, then you're probably going to make a decision that you'll be okay. And that's unfortunate for that mother and ultimately for that child.
So you mentioned education and maternal mortality. I mean, how do you prioritize? And those are two big, huge things. And I know there are others, but how do you prioritize what you be an advocate for?
Yeah, so that's a question, especially as the new director for Arkansas Advocates. It's trying to find that balance, because unfortunately for Arkansas, I have so many conversations where the common theme is we can only go up, but the areas are so vast. So healthcare is our biggest priority. It's one of the things that we're often at the table about, but we also do prioritize education again, because it's so significant for children and families. And then we really do try to work as it pertains to just poverty and how to raise individuals out of that. And that can encompass a lot of things pertaining to livable wage or pertaining to, it can also include housing and transportation, right? Because if you get a good job that pays you a livable wage, you got to get there and you got to be able to have somewhere to stay before you go to work every day. So all of those things are intertwined. And so trying to determine what is the priority in those respective areas can be tough, but they're things that we have to advocate for.
And what does the expansion of postpartum Medicaid coverage look like for our state?
Yeah, so right now we are one of only, I believe the last time I checked, we're one of 3 remaining states that have limited postpartum coverage. So right now in Arkansas, if a woman is on Medicaid, her coverage ends 2 months post having a baby. And so what has happened within our state is that there are other categories of Medicaid that women are eligible for and can be moved into. But I was a mom when I had a 2-month-old newborn. That would have been the last thing I was thinking about. And so unfortunately, what we've seen is that several women drop off the rolls. And when you drop off the rolls, there's a tendency to not get healthcare coverage for yourself, not go to your visits, and also not take the baby for their visits. And so what we're advocating for is for that to be extended to 12 months so that moms don't have to worry about that during that time.
So there's been talk about laws that help physicians to offer postpartum depression screenings and to new mothers and requiring Medicaid to cover those screenings. Yeah. There's some laws passed in Arkansas for that. There were.
So during the last legislative session, I definitely want to congratulate Representative Pilkington because he really pushed forward many things pertaining to maternal health, and we were very excited to see that. So he did get Act 562 passed, and that stated that Medicaid would have to do a depression screening during the pregnancy, and would have to cover that screening. So to try to catch any type of, signs of depression early on, which was really great. And then Act 316 passed, which stated that both Medicaid and all insurances had to cover a depression screening at the time of birth. And so to really gauge where mothers are at, because when we talk about maternal health, a lot of individuals think about what happens when a mom during her pregnancy and when she gives birth, but pertaining to our mortality numbers, we know a lot of things happen once women give birth. And so trying to catch those things, especially pertaining to depression early on, was a priority. And we did see some good legislation pass this session.
Yeah, those are both big wins.
Very big. Glad to see them.
And there were several maternal health and abortion policies introduced during the legislation as well. What did those look like?
So there were several, but a lot of them were held, and concerns about, there were a lot of big pieces of legislation passed during the session. So some of those things were laid on the table. So the 2 bills that Representative Pilkington had pertaining to the items that we just discussed, so postpartum coverage by Medicaid, and equally the ability to get pregnant women on Medicaid faster, both of those things were filed and did not pass. Equally, we did see, I believe, Representative Hudson filed a bill pertaining to an exception pertaining to abortion, because, we have a full ban in the state of Arkansas, but her bill would have allowed for an exception for a medical emergency for the mother, and equally in the cases of incest, and that did not pass either. So there were some things that individuals started talking about pertaining to both of those areas, either Medicaid coverage for moms, other maternal health matters, and abortion that, aside from the ones pertaining to depression screenings, those were really all the other things they're being looked at right now.
And there is a proposed universal home visitation program for mothers with newborn babies. What is that?
Yeah. So, and we've had some home visiting programs before, but they were for very specific populations, whether it's because of how much money you make or because maybe your child was born early. But this proposal proposes that all moms have an individual, and there's some debate as to whether that individual should be a nurse or can they be some other type of healthcare professional, but having a program where someone is coming and helping moms and checking in and seeing whether or not they're taking care of themselves, how's the baby doing, and how generally laying eyes on a mom. Because if you get a phone call when you're dealing with a newborn baby, you might say everything's fine because you're trying to go back and handle all of those things. But being able to actually look at the mom and be able to assess, are things really fine? Or does this new mom need some additional help?
Is that something a healthcare provider could plug them into and connect with?
Yeah, that's the hope. So it hasn't passed yet. And so the biggest thing is that they have to look at costs. I know that the proposed sponsor, the individual that's been talking about this bill, one of the things she really wants is for the individuals that are coming into the homes to be a nurse. But we have a nursing shortage in the state, right? So they have to determine what's the right professional to be out there. And once that's decided, what does that cost look like? But I truly do hope that when it passes, it is something that easily providers can tie their new moms into.
So what is ahead? What's ahead for our state? The future is bright. Yeah. You guys are advocating for some really incredible change, lots of really great things. What does the future look like?
I have been encouraged. I've talked to a lot of legislators over the past couple of months. I think maternal health and infant health is on the forefront of legislators' minds. So if I'm thinking about the things that we advocate, that's a big thing. Individuals are tired of Arkansas being at the bottom in rankings, and they equally know that because we are a smaller state, we can put policies in place. We can put some foundation in place that can move Arkansas forward. And they are really looking at those solutions. And so that's extremely exciting because we don't want to continue to be at the bottom. We know what the problems are. We know that moms don't have the proper access to health care that they need. And we equally know that they need more support once that baby is born. And as Arkansans, we can do that. So I think that's the big thing on the horizon. Equally, in the areas of education, we know there's a lot of changes pertaining to that. So I think it's, seeing how these policies are being implemented, but also continuing to have conversations about what's happening, not just in Central Arkansas, not just in Northwest Arkansas, but across the entire state. Because sometimes Little Rock and the Northwest, Arkansas corridor can kind of take all the oxygen out of the room, but in terms of just the population of those areas. But there are a lot of folks that are having conversations about what's happening in rural Arkansas, and we absolutely need to increase that conversation as well.
Well, I appreciate you increasing the conversation, the awareness, the advocacy. Thank you. Thank you for all you do.
Thank you. Thank you for asking me to come over.
Well, it's been a pleasure learning so much about what you are doing in the state, and the future is bright under your leadership. Thank you.
Oh, thank you. I appreciate that.
And that's it for this episode of AFMC TV. Thanks for watching, and have a great day.